This is Talk Business and Politics with Roby Brock.
Well, in case you haven't noticed, there's been a little conversation going on surrounding health care reform for the past few years. The Affordable Care Act, also known as Obamacare, to the private option, to an overhaul of health market reforms. We often cover the political side of this debate. Time for a business view. I'm joined by Mark White, President and CEO of Arkansas Blue Cross and Blue Shield, the state's largest health insurance provider. Thank you so much for being here.
Good day, Robbie.
Let's talk about what's going on. I mentioned just there in the introduction about all of the things that the health insurance markets have been in turmoil over, might be one way to describe it. How difficult is it for you to kind of plan for some of the changes when we don't have answers to all the questions yet?
Well, it is a challenge, and there has been a lot of change dating back to the passage of the Affordable Care Act in 2010. So from that point till now, our focus has been on understanding the variables and how we deal with those, and there have been a lot of variables, but I think as a company and in our marketplace, we've been able to plan for enough contingencies to be prepared for whatever came our way.
What's been one of the bigger variables, more difficult challenges to kind of anticipate and deal with in that respect?
Probably from the standpoint of the actual rollout of the ACA and how the enrollment would start initially with the healthcare.gov, which everyone knows was a little bit of a challenge. So that was one of the more significant issues that we had to deal with. How were we going to enroll these individuals and communicate with them and be sure that we did it correctly the first time?
Now that you're seeing numbers, and for instance, you've seen an increase in some enrollment figures, obviously that was one of the goals of the Affordable Care Act, was to get more people in the health insurance system. Is that helping from the planning standpoint? You got bigger numbers to work with now? We
do have bigger numbers to work with, and before we started down this path, I believe there were around 500,000 Arkansans that were either uninsured or underinsured through either the Healthcare Independence Act or through the ACA. We've picked up in our state probably 260 or 70,000 of those 500,000, so we've made a good headway in that regard. But we still have over 200,000 Arkansans who don't have coverage today. That
spreads the risk, having more people in the pool, so to say, in that respect.
That's the important.
Does that drive the cost down of health insurance?
That increases the expectation of what we think costs will be. From the standpoint of if you have smaller numbers, you're going to have more variation from month to month or year to year. So yes, it helps.
Let's talk about some things happening at the state level. You mentioned the Healthcare Independence Act. Asa Hutchinson, new governor, has obviously laid out a plan for ending the private option, which came out of that particular piece of legislation by the end of 2016. There's a healthcare reform task force that's been put in place. It's all legislators. There's not any business or industry on that, although I'm sure there's a lot leaning on those legislators in that respect. What are your expectations for what that task force will accomplish?
Well, the charge for the task force is to make a recommendation to the governor by the end of this year towards what should be the solution for the Healthcare Independence Act going forward, which is scheduled to, as you said, to end at the end of 2016. It's operated under a waiver program that was actually scheduled for 2014, 15, and 16, so that's a natural conclusion for that program. The question is what's done after that. Mm-hmm. And you know, it's anyone's guess at this time, but I know the issue is highly political as far as people that are for it, the program continuing or being altered, and people that are totally against that program. I would say that it's been good for Arkansas from the standpoint of well over 220,000 Arkansans who now have coverage that did not have it before. It's been a major boost for our hospitals and physicians who historically have delivered a lot of uncompensated care that they're now paid for.
One of the things that we've talked to some of those politicians that are involved in this policy making has been about a 1332 waiver, which gives a lot of latitude to what can be constructed in terms of a health insurance market for Arkansas. I mean, can you see a vision for what health care could be, what health insurance could be in Arkansas as a result of all of the cards that are kind of out there to play with? Or do you think at this point in time, as this task force moves forward, it's kind of a wait and see? It's still murky.
Well, from our standpoint, we talked about the turmoil and change, and we're still preparing for more options than just one. So it's a little murky from our perspective. I would think that there is a program that would work for Arkansas and would help us achieve nearly a fully insured population. To me, that's good. In Arkansas, we've got one of the higher risk of morbidity, meaning people that have poor health status. We're not the lowest in the nation, but we're within near distance of the lowest in the nation. I think we rank about 48th of 50 states. So in regard to that, we've got to have a solution going forward.
Do you think that solution will be kind of an incremental solution? Do you think it will have to be a transformational solution?
I think you mentioned the politics that are there and the different perspectives. So ideally, transformation's good, but realistically, it's probably going to follow an incremental path.
Yeah, that might not be bad though.
Yeah.
Businesses can like incremental change because you can deal with that a little bit more in a planned phase than you can something that maybe overhauls everything altogether.
Sure, except that, you have continued disruption year after year as you deal with those increments.
Well, speaking of disruption, you got a lot of technology and innovation happening in healthcare markets these days too. Does that necessarily drive down the cost of healthcare, or does that basically make it more expensive, or maybe just depends on what the technology and innovation and the disruption are?
Well, you said the word, it depends. I would tell you that I believe that technology has really improved the quality of health care that's available for all Americans, from standpoint of new pharmacology, of new high-tech imaging where diseases can be more precisely diagnosed and treated. So from that perspective, technology helps. But technology does have an expense associated with it, and I guess the jury's still out on whether it's had a net reduction in cost. If you go back several years, technology's continued to march forward. And I don't think that's going to stop, because we have people interested in finding new and better ways to practice medicine, to conduct health care, to take care of individuals that need care. So I expect that my view was it's going to cost a little bit more money. In many ways it will save money, in many ways it just adds to the overall healthcare dollar that we spend.
I kind of asked this question a little bit at the front end. I'm going to ask it a different way. You get to wave a magic wand, look in a crystal ball, you get to design the outcome of this legislative task force however you want. What would you like to see?
I would like to see some form of a continuation of a program that's going to bring more Arkansans into health care coverage than we've had historically. It's important for them, it's important for their health and wellness long term. My view is that healthier citizens are more productive citizens and will help the overall economy.
All right, Mark White, CEO and President of Arkansas Blue Cross Blue Shield, thank you for being with us this morning. Appreciate you.
Good to be with you.